Okay.
Did they schedule it through the BOC?
Good morning, everybody. It is Wednesday, October 7th, and we are here in the Center hearing room for our board session. It is 9 o'clock, and as always, we start with the Pledge of Allegiance. So if you'd please join me.
If you don't announce it, you can't.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We don't have anyone signed up for public comment this morning, so our first presentation is going to be a COVID-19 update from Katrina Rothenberger. Good morning, Katrina.
All right, good morning. I'm Katrina Rothenberger, Public Health Division Director for Marion County Health and Human Services. As of today, we have 5,033 cases in Marion County. 101 folks have died, and 56,000 people have been tested total. For the week of September 28th through October 3rd, we saw a 7.6% positivity rate, which has gone down considerably from the previous weeks. There were 241 new cases, and our testing rate was the highest it's ever been since July of this year at 94.6 per 10,000. So our testing capacity is increasing now that we're through the immediate threat of wildfire. On Monday, the CDC updated their guidance. There is evidence that under certain conditions, people with COVID-19 have infected others who are more than 6 feet away. These transmissions primarily occurred within enclosed spaces with inadequate ventilation where the infected person was breathing heavily. Under these circumstances, scientists believe that the amount of infectious, smaller droplets and particles produced by the people with COVID-19 became concentrated enough to spread the virus to other people, and the people were infected were in the same space during the same time or shortly after the person with COVID-19 had left the space. Yesterday, Governor Kate Brown announced a plan to deploy an influx of rapid COVID-19 tests from the federal government. Oregon will be receiving 60 to 80,000 COVID-19 rapid tests per week until the end of the year. The Abbott BinaxNOW antigen test can diagnose cases of COVID-19 in 15 minutes. And with this increased testing capacity and this fast rapid test, we'll be able to identify outbreaks and test people, isolate and quarantine them more quickly so we can break those cycles of transmission and slow the spread in Marion County. These tests will be deployed statewide, but they will prioritize communities, especially those with long-term care facilities that have been affected by wildfire evacuations, people from communities that have been hardest hit and most disproportionately impacted, including migrant and seasonal agricultural workers, communities of color and tribal communities, and people living in congregate care settings. And then people living in places most vulnerable to COVID-19 spread, so congregate care, Department of Corrections facilities, and other community testing locations, federally qualified health centers. And then last, Halloween is approaching, and we want to make sure that our friends and family are able to celebrate in a way that works for them. The Oregon Health Authority and CDC do recommend that Oregonians avoid traditional door-to-door trick-or-treating or trunk-or-treating events because they are higher risk for crowding among people outside your household. We do have some tips on our website, though, if people do decide to go trick-or-treating. We have some information graphics, and they're on our website at covid-19.mchealthy.net under multiple languages. And some of these tips include staying home if you're sick, talk with your children about safety and physical distancing, limiting your gatherings to 10 people or fewer, using duct tape or another way to mark 6-foot lines in front of your home. Participate in one-way trick-or-treating to hand out treats, position a table between yourself and trick-or-treaters, distribute treats on disinfected surfaces, and then if you're preparing like goodie bags, washing your hands for at least 20 seconds, and individually wrapping treats or goodie bags lined up for families to grab and go while social distancing. So we just have to adapt our new way of life so that we can reduce the transmission of COVID-19 in our community, but, we still want to have a little bit of fun while we do that, right? So That's all I have. Thank you.
Thank you, Katrina. Are there any questions for Katrina?
I haven't heard about fun for a long time, so that was pleasant.
You'd like to have some, huh?
Wouldn't that be good?
Yeah. Okay. Thank you.
Thank you.
Just,
Oh, yes.
Katrina, we've got some more drive-through testing plans set up in some of our harder hit areas, right? You want
That's
to share any
correct.
about that?
Yes, it is on our website. They are up in Woodburn. I believe the next one is tomorrow. Okay. And the other one is October 15th from 4 to 7 p.m. And you can go on our website to get more information about how to sign up. We are asking that people do pre-register. And there aren't any barriers to getting tested, so you can test it even if you are asymptomatic. So sometimes if you go to a traditional healthcare clinic, you might not be able to receive a test unless you have symptoms.
That's great. I just want to thank our community partners for setting those up. The weekly calls that we have and the community organizations up in Woodburn and surrounding areas have really stepped up volunteering to get those things done. So
Absolutely.
great. We appreciate it. So you can go to our website, the health department's website, right?
Yes.
Okay. Thank you.
Thank you.
Okay. Thank you, Katrina. Next up, like we have Melissa Rounds.
So Stephanie Bob is running late.
Okay. Okay, sure. So we are going to move on to our agenda and we'll come back to our United Way employee contribution kickoff once Stephanie Bob arrives. So we'll jump into our consent agenda. It's
I'm
Commissioner
getting
Cameron's
a friendly
turn.
nod and a point over it,
All
that it's my
right.
turn.
Now, I would like to give you one idea that you could do is just make your motion to include all the names that are on this list rather than read them separately. But that's up to you, and I'd rather see you go through the list.
You know what? If my name was on here, I'd want to hear it out loud.
Thank you.
So I think you would too.
Oh, I know
right?
it.
So let's see how I can do. All right. Good morning, everybody. I'm going to move the consent calendar, Mr. Chair. Under Board of Commissioners, OLCC applications recommend approval for Ankeny Vineyard Winery LLC, DBA as Ankeny Vineyard Winery. You ever been there? Nice place, huh? Health and Human Services, approve an order appointing the following individuals as director designees to the Marion County Community Mental Health Program Director and allowing them to authorize emergency actions in the community mental health program. And we are so thankful for these people. Anne Marie Banfield, Mario de Abeldia, Lindsay Ball, Mark McIyer, Alan Rainwater, Pauline Griffin, Deborah Wells, Daisy Barrios, Joanna Herrera, Alyssa Lay, Joseph Enderas, Anna Osquilia, Lisa Stewart, Esther Sanders, Vicki Byrne, Anna Marie Maddox, Anna Masiria, Heidi Miller McSmith, Joseph Rocky, Emily Redding, Andrew Davis, Sophia Benedictino, Catherine Martero Strait, Deborah Nelson, Alyssa Shaw, Alexander Tippin.
That was very courageous of you, Commissioner.
I'm-
I'm very impressed.
I know they wanted their names read. I don't know if I read them all properly, but I had a little
Like
accent.
50%.
You
tongue
gave
roll
it the
in
old college try anyway.
I don't know. I was mixing my German, my Spanish, and my
McIntyre
English
caused you the
together.
That's
most
good.
difficulty.
Under Human Resources, approve a recommendation to adjust upward the pay grades for classifications 092, County Public Information Coordinator. Number 190, County Emergency Manager. Number 407, Emergency Preparedness Coordinator. Number 451, Electronics Technician 1 Communications. Number 453, Electronics Technician 2. And update classification 092, County Public Information Coordinator. And number 407, Emergency Preparedness Coordinator. Under Public Clerks, schedule a public hearing for November 4th, 2020 for a comprehensive plan amendment zone change participation CP CZP, case number 19-003, Alagos. Received notice of a hearings officer's recommendation and scheduled public hearing for October 21st, 2020 for Zone Change Comprehensive Plan ZCCP, case number 20-003. MF Baki Builders Home Exit LLC, 25 Years LLC, Gene M. Miller Family Trust, and Harlan Miller Trust. And finally, schedule a final consideration to adopt an administrative ordinance for October 14th, 2020 for legislative amendment LA case number 20-002, amending the Aurora Donald Interchange Area Management Plan and conforming amendments. No wonder you gave that to me.
Second.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. Motion passes. Wow, that was some real work.
He was smiling when he pointed at me. I know why. And I read that this week and I went, I know he's going to want me to do that one.
All right. Next up, we have Ryan Matthews. Are you here? We're going to consider approval of amendment number 3, the incoming funds intergovernmental agreement with the Oregon Department of Human Services to add $300,000 for a new contract total of $600,000 for mental health clients' vocational rehabilitation services. Good morning.
Good morning. Ryan Matthews, Health and Human Services Administrator. I am here seeking approval of an incoming funds agreement with DHS for $300,000 for job placement services. This agreement is associated with our supported employment team. We staff employment specialists who work with adults who have behavioral health challenges in helping them to obtain employment. So what this team does and what this contract helps to support is initially supporting the individual in terms of determining what level of employment they're interested in, what type of employment, what kind of profession. They work with employers to build relationships, to make sure that we have supports to help with onboarding, with training, on-the-job training, and to make sure that the employers feel comfortable, employing these individuals and knowing that there'll be a support system around them to make them successful. And they also work with our treatment team, so they'll work with the case manager to build this into their treatment plan, because we really see that there's a lot of self-worth and a lot of value in being able to obtain stable employment, and this really goes a long way in helping people to overcome some of the behavioral health challenges that they're facing. It's one thing I wanted to highlight is even though the pandemic has been with us now for 7+ months, and it certainly impacted the job market, this team is still active. They help support people transitioning from in the office type of work to helping them transition to being able to telecommute and maintain employment. They've been continuing to work with individuals to find new employment opportunities, even during kind of this challenging time. This program supports about 100 individuals, and traditionally, and this is really the case statewide, this program really only has about a 3 to 4% unemployment rate. They're pretty successful in getting people employed and helping them maintain those job opportunities. And this particular agreement with DHS supports the non-Medicaid population, which is about half of that 100 that we serve. The remainder is covered by our contract with Pacific Source, the CCO, that provides the support and services for the Medicaid population. And so I'm happy to answer any questions that you might have.
Thank you. Ryan, are there any questions, Ryan? Oh, this sounds like great work. So
It is. It's really a great program. Yeah.
thanks for supporting it.
Sure, well, so if I could, then I'd make a motion that we do approve amendment number 3 of incoming funds intergovernmental agreement with Oregon Department of Human Services to add $300,000 for a new total of $600,000 for mental health clients' vocational rehabilitation services, and that's through March 31st, 2021.
I'll second the motion.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. Motion passes.
Great. Thank you.
Thank you, Ryan. Okay, next up, we have Michelle Shelton and Kathy Carter, and we're going to consider approval of the Health Insurance Study Committee renewal recommendations to the Marion County Law Enforcement Association and the Non-Mclea Health Insurance Plan for plan year 2021. Good morning, Michelle.
Good morning, Commissioners. Michelle Shelton, Chief Human Resources Officer for Marion County.
I'm Kathy Carter. Who am I? Benefit Specialist for Marion County. Good. You guys are so.
And we are here to present the 2021 health plans for both the MCLEA, which is Marion County Law Enforcement Agency Group Health Plan, and the non-MCLEA health plans, which is everyone other than Marion County Law Enforcement Agency. Both agencies, or both plans, have what's called a HISC committee, which is a health insurance study committee. And those health insurance study committees review the plan design, the utilization, and the cost structures of the plans every year and make recommendations to the board for changes to those plans. For 2021, MCLEA met throughout the summer to review the plans, again, utilization, carriers, renewals, and plan design options. And because of our very competitive renewal structure, they are voted to recommend for the Pacific Source Preferred Provider Plan to accept the renewal, for the Kaiser Health Maintenance Organization Plan to accept that renewal, and for the dental options for both Kaiser and Delta Dental to accept that renewal. In addition, we have the non-MCLEA recommendations. And again, that is the 4 other unions and the non-represented employees. Under that plan, we do have a HISC for that for those plans as well. And the HISC committee reviews those options. Again, they look at cost structure, they look at plan design and utilization, and then the renewal rates, and make a recommendation. And we met throughout the summer for those as well. And the non-MCLEA HISC recommended to accept the renewal rates with no plan changes. And under those plans, are a little bit different than MCLEA. We do have the Pacific Source Preferred Provider Plan, and they voted to accept that renewal. We also have under Pacific Source a high deductible health plan, and they voted to accept that renewal. We have a Kaiser HMO, and we voted to accept that renewal. And again, 2 plans under dental, both Kaiser and Delta Dental. Now, not part of the HISC, we also have a health savings account, and that is something that is in addition to the high deductible plan. Marion County makes a contribution to the to the health savings account to offset the cost of the high deductible plan, and we are recommending that we continue the current contribution structure for those plans. Are there any questions?
Thank you, Michelle. Yeah, Commissioner.
Yeah, Mr. Chairman, thank you. Thanks for being here today and all your work that your people do on this. I'm looking at the projected annual taxes. I guess that just answered my question when I read it. It's probably on page 2. Mm-hmm. So those are annual taxes per policy. So if I look at the Oregon premium tax at $31.76, that's for an annual basis?
Per employee per month.
Per employee per month.
So that there's a 2% charge.
Right.
Yes. So in 2020, it was $31.76. In 2021, it's $32.87.
And then there's the health insurance. I think you did this in a work session, but the health insurer fee that's now $41 per employee per $41.29 per employee per month. And last year it was nothing.
Last year, actually, it was $41.29, and this year it was nothing because
I'm reading it backwards.
Yeah.
Yeah. Okay.
That tax went away.
Okay.
Luckily.
What tax was that? Do we know? Was that a federal tax?
It's a federal tax, correct.
Okay, so that's good news. So we're paying $40,000 a month basically next year to the state in taxes on our insurance policy.
For Pacific Source.
And then $45,000 a month for our policy on Kaiser. So we're sending a check to the state for $85,000 a month for taxes on our insurance policy.
I believe it's baked into our premiums, but yes, in
Right,
theory,
it all
yes.
goes
No, I'm glad you broke it out. The people need to know that, why our insurance is going up.
Yes.
And where some of the premiums are going to. And do we know what that tax is used for at the state?
I don't have the answer to that, but I can get that for you.
Oh, okay.
Kathy, do you know what that is?
We don't know where a lot of the money that goes to the state gets used. probably for the Oregon healthcare plan, I'm sure. Okay, that's all I had. Thank you, Mr. Chair. Good news for our employees, though,
Yeah,
right?
absolutely. Chris, do you have any questions?
No.
All right. And I would entertain a motion.
Yeah, Mr. Chair, I'll move that we approve the Health Insurance Study Committee HISC renewal recommendations of Marion County Law Enforcement Association, MCLE, and the non-MCLE health insurance plan for plan year 2021.
I'll second it.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. Motion passes.
Thank you,
Okay.
Commissioners.
Thank you.
Thank you, Michelle. And thank you, Kathy. Okay, next up, we are going to consider approval of the annual recertification of Marion County's participation in the community rating system of the Federal Emergency Management Agency. And it looks like Brandon Reich and Lindsay King are here. Good morning.
Morning. Good morning, Commissioners. For the record, Brandon Reich, Building and Planning Division Manager.
And Lindsay King, Associate Planner. Good morning. Be going over the Community Rating System recertification. Oops, that is not how I get to do it. So I'll first go over some quick phrases here. So FEMA, the Federal Emergency Management Administration, the National Flood Insurance Program, so the NFIP, this is the program that FEMA sets forth that allows us to give discount insurances to those in the flood areas that build. Otherwise, flood insurance is extremely expensive. The Community Rating System is the program that we're looking to recertify. The CRS program is designed to alleviate the cost burden of flood insurance through higher standards in floodplain management that's done through our zoning code. These standards are designed by FEMA and implemented by us. They do have a minimum standard. We're well exceeding that. The classes go from 1 to 10, 10 being the lowest, 1 being the highest. I don't actually know of any that are class 1, but we are class 6, giving 20% discount to our residents in the flood areas on their insurance. So most homeowners policies do not cover flood insurance. That is an extra that they will have to add on. Federal grants and loans are not always available after disasters, which can be quite costly to the residents. Even a few inches of water in a home can cause severe damage to where they would not be able to rebuild. And federally backed home loans usually require some sort of flood insurance if they are in the special flood hazard areas. How we get credit here in the county is a number of ways. Natural hazard plans, building codes, our flood ordinances, stream regulations, outreach activities, information, maintenance availability, and this is just to name a few. We have some items that we need to keep our eyes on for the future. As we rebuild after the fires, especially substantial damaged properties will need to be reviewed for current standards in the floodplain, which means many of these structures were built prior to any National Flood Insurance Program standards or FEMA floodplain standards. So they're essentially non-conforming. So that'll be something that we'll need to keep an eye on for. Also, the state and federal agencies are working with the Endangered Species Act to keeping areas open in those floodplains for natural discharge, specifically for fish and other aquatic species. So there are workshops going on right now to discuss it and figure out what we're going to be doing in the future, what they are going to be doing, and to help us implement any new items that we need to take into account for our zoning code. Oops. And I'll stand for any questions you might have.
Any questions?
Well, just to be clear, and I'll look to Brandon, we talk about this every year. Our rating doesn't really change too much, but we've done what we can, almost within practicality. But the additional things we could do, kind of diminishing returns, we don't get a lot more out of it. Any any changes in where we are, what we could be doing or should be doing?
So when you look at other jurisdictions, you can see that it's common that they are within a pretty narrow range, or they stay at their level for quite a few years. The amount of additional work really depends on if it's of value to the county to do these work or to add additional standards for development in areas or additional mapping. There are opportunities to get additional, possibly to get additional discount. It can be a fair amount of work for the amount of discount additional. And it could mean additional standards people develop to, or additional types of regulations that would apply, like to drainage areas, that could apply to everyone in the county in order to get a discount on the flood insurance for those portions of the county in the floodplain. So it's definitely, the core of the program really is it of value to the county? Is it important? Is it part of what we're doing? And if it is, then we attribute what kind of point system can we get out of the CRS. To go after points can sometimes be not only diminishing returns, but it can also kind of feel like a lot of effort, a lot of regulation for something that doesn't have that return.
So nothing jumps out at you, basically. I saw the wildfire thing, and that could change how we look at things, but nothing you say, we really ought to do this. That isn't in front of, right?
One of the things CRS would look at from the wildfire would be if we did mapping related to the wildfire for additional areas in the floodplain or areas up there in the floodplain, we approve those maps, and we could get credit for that. Now, the area that we map up in the canyon would be prorated that amount versus all the floodplain. So whatever work we did, we might get 10%, 5, 10, maybe 12% of the points that were available for that work. So we do quite a bit of work, and we might get 20 points. Say we might need 500 to get to the next class. We every time we go through the cycle visit, which is like the audit, identify areas for improvement. And we've worked on those areas of improvement, and depending on how CRS scores us against other communities nationwide, our values change and they vary. And so there is not a definite bright path to a certain number. But we are working on additional areas of improvement. And all the planners have aspects of CRS to work on and to develop for our next cycle visit. We'll be ready in time.
Thank you.
Okay.
So,
You have another question, Commissioner
oh no, I guess, yeah.
Brentano? I didn't
All
know
right,
what-
then Chair Wills, I'd make a motion that we do approve the annual recertification of Marion County's participation in the community rating system of the Federal Emergency Management Agency.
I'll second the motion.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. Motion passes. Thank you.
Thank you, Commissioners.
You did good. This is your first time here, right, Lindsay?
Yes,
Yeah.
it is. Thank you.
You're very
Welcome.
welcome.
Thank you so much.
It's good to have a whole new planning team going on.
Oh, you didn't like the old one?
Well, the old one's still here, right?
Yeah, Joe and I, we're still here.
Just all this great talent that you've recruited, Brandon. Thank you. And I think we're going to be really busy here.
I
If
agree.
we're not already, with all the fires and everything, so.
And thank you for the opportunity to
Yeah.
involve it. We hope to be very talented and for you and
Yeah.
to provide that. So, thank you.
Okay, we're going to go back to our United Way 2020 Employee Contribution Campaign Kickoff. Melissa and Stephanie, come on up.
First of all, let me apologize for being late. I've had this on my calendar for 10 a.m. for a very long time, and I think that wildfires have really affected our ability to track and be on time and do things the way we normally do. So I am just profusely sorry. But with that said, I'm going to fog up my glasses here.
I am Stephanie Vaughn. I'm the Resource Development Manager with United Way.
There I am. I had a PowerPoint to start with. Oh, got it. So, as I stated, United Way is doing things a little differently these days. 3 years ago, we changed the way we did business and started refocusing on call to actions and what our community needed. And we have done that with developing housing for all, basic needs, building capacity, and strengthening families and children. But underneath each one of those things is narrows down just a little bit of what we're focusing on with regarding to affordable housing, the mobile shower trailer, things I talked about last year, but things that we continue to work on today. The asset limited income constrained employees in Marion County is 30% households with 11% living under the poverty rate. Now, the other counties compare something similar, but still this is what our service footprint looks like. It's Marion, Polk, and Yamhill counties. Student poverty, however, jumps. Student poverty at 66% in Marion County with 1,835 experiencing homelessness or couch surfing. Unsheltered, we have 995 in Marion County. These numbers might be a little off because the PIT count hasn't been done for a while. 394 of those are women, which led us to our decision to open Safe Sleep. When the pandemic hit in March, we shifted gears pretty quickly at United Way and started a food program. And the first week, we were serving just a few homes, and by the next week it was more, and now it's 650 each week that we're serving. I'd like to show you a video that an actual volunteer put together for us. It's a little choppy. It is me speaking for a minute. It takes about 3 minutes, but it does give you a really good idea of what our program looks like.
When COVID hit in the middle of March, we had some donations received by Amazon for our 360 program. It was mostly dry goods, not a lot of perishables, but we immediately transitioned into getting some stuff out to individuals who were either compromised, homebound for whatever reason, or seniors. So since the middle of March, we started with 40 families or 40 homes the first week, transitioned to 160, transitioned to over 200, and now we serve over 600 people every single week. The food boxes are bags. They're intended to serve one individual for an entire week. Breakfast items, lunch items, a lot of dry goods, but we also package milk, eggs, bread, cheese, and try and give them some meal options. In the celebration of 4th of July, we gave them hot dogs and hot dog buns and ketchup. So we're trying very hard to make sure that it's not one meal at a time, that they have enough to sustain themselves, they can make themselves a snack, have breakfast. We're hearing some incredible stories from our individuals that we're serving. We're the only organization that's serving them. Without us, they wouldn't have their food.
Like I said, the tone of voice, sense of humor, and just everything that we care personally.
The relief program box has helped me because it gives me stuff to take over. It's got food in there that I can use, and if there's something that I can't use, the caregiver has a bigger box that I fix when I'm working. So if there's something that I can't eat, I just give it to her. So it's being useful, and that's really nice.
The program has gotten so robust, and it serves communities not only in Salem, but in Marion and Polk counties. It's nice that our reach can go so far, and I think that individuals are super appreciative. We also partner with the North Marion Parents Association, which is actually in Hubbard, which is a way reach out the corner of Marion County, and they also serve Glenburn and Aurora area as well. So the fact that our employees and our organization can't get out to those organizations, and we have volunteers who are coming and doing those things and taking them out to those organizations, just allows us to reach just a little bit further. Phone calls come in quite often, notes come in quite often, and every time you think that maybe someone is being overserved or they don't need a box any longer, then you get a phone call from someone in tears that said that they haven't had fresh milk or fresh eggs in weeks. And so we're just going to continue doing this work as long as we can. At the beginning of the COVID, we received numerous large grants that have allowed us to do this work outside of the United Way annual budget. Those funds are starting to come to an end. They're depleting weekly. We're spending anywhere between $6,000 and $10,000 a week on groceries. So as you can imagine, any large funding would be depleted rather quickly. So effective immediately, we're going to move to an every other deep food program and just try and stretch our dollars for the summer. But if any funding comes in that we weren't expecting, of course, we'll leave that right back out to the weekly and make sure that these folks are getting the things that they need. Moving forward, the United Way of the Mid-Willamette Valley has been a catalyst, and so we fundraise and then serve the needs of our community. We have always tried to listen to the community and give them what they need. Due to COVID, the way that we do business is obviously going to change. Our workplace campaigns are going to change. Our partnerships are going to change. There has been numerous individuals who have given to United Way lately that haven't given for years. So as we move forward, I don't see us transitioning completely out of the food box program for quite some time. It's not our normal, we're not a food pantry by any stretch of the imagination, but what we need now is volunteers, we need donations, and we need partnerships. We listen to the needs of our community and try and meet those needs with programs such as our hygiene trailer, Taylor's House. We're now looking at Crew, which is going to be a mental health plan. There are other things that we're looking at. It's not just food boxes.
So as a quick update, we did receive funding. We received $90,000, and the food box program ramped back up. And so on my hurried drive in here, I was on the phone trying to manage the food box program as well. Then the wildfires hit, which I know some of you in this room know about all too well. And we again sprang into action. This is a look at the hub that we put up across the street from the fairgrounds. We were able to serve the needs of the evacuees the very next day with basic needs, camping equipment, food, diapers, clothing, you name it, we had it there. And we had a video put together by Lillian and Josh Kay with some friends that they have, and I'd like to show you that wildfire video as well.
They were being evacuated. We're really scared. There's fire on both sides of the road. Make sure the boys and our bear know how much I love them. We have dogs and grandma's babies. I love you guys, okay? Don't forget that and take care of each other. If anything happens to us, we love you guys. We couldn't come down to Salem because the road is all blocked. There's trees everywhere, and we have to wait until they cut the big logs to get through the road. And I want you guys to know how much I love you.
So that hub is no longer there. We went ahead and moved those items to the United Way office. And we also have a partnership with Truett down on Front Street, and they're a warehouse, 33,000 square warehouse that is housing a lot of these things. And so we get basically a shopping list from anyone in the canyon, and they can get anything that they need from us, and we will drive it out to them. Anthony Hall and Sublimity, Gates, and Mill City are all areas that we're delivering to. We delivered to Glide yesterday, and we've been helping out Warm Springs as well. We've been in touch with the mayor of Detroit, and as soon as they get a location, a building, they're going to open a hub there for those individuals as well. We are part of a distribution on Saturday to get some supplies out to individuals in Detroit, and the United Way of the Mid-Willamette Valley forged a partnership with the Detroit Pistons, and gifts are being given to each one of the residents of Detroit on Saturday because of that partnership. Pretty proud of that. We also, of course, have our mobile shower unit. This was over at the fairgrounds 2 days after the evacuees were there to give them access to some basic hygiene and serve those individuals. It's still serving our unsheltered. COVID has proven to be a little bit more challenging than we expected with regards to cleanliness, but we are keeping that shower trailer up and going. Safe Sleep opened on December 15th of 2019. We house up to 19 women every single night. It's a warming shelter from 7 a.m. to 7 p.m., 7 p.m. to 7 a.m., sorry. But it is only a warming shelter with low barriers, meaning that they have to take all their belongings with them the next day. We partnered with Sackcloth and Ashes to provide bedding each night for these individuals. And now they're part of our food program, and Linnell is able to feed them dinner and breakfast every morning. Taylor's house continues to be full. They had an opening not too long ago, and a gal was immediately put in there who had run away from home because she was pregnant, didn't want to tell her family. So now she's residing at Taylor's house until she's able to have her child. I mentioned CREW pretty quickly in the video, and Crisis Response United. It's a program we've been working on for about a year. It's modeled after a program in Eugene called Cahoots. It's intended to be first response to individuals who are in crisis. Right now it's a 911 to individuals, and then the police or fire respond. And we're hoping that CREW will be that and take the pressure off of our local law enforcement and be able to take those calls, make decisions, and get these folks the help that they need. This program is near and dear to my heart. I do run the Women United program at United Way, and hygiene kits were a barrier for individuals to be able to go to school, work, homelessness, and so we started this project over a year ago and have been able to put feminine hygiene products into individuals' hands who need them. When COVID hit, the program kind of stopped because these little carts are in the schools. And then we started delivering them to the meal sites in partnership with Salem-Keizer School District. And now these bags are still being given to the individuals who need them, and they're requested on a daily basis. Villages United is one of our newest programs, and it serves basic needs for seniors. It's a Seniors Helping Seniors program, but there are 16 seniors within the Villages United program that are receiving food boxes from us on a weekly basis. We also have a partnership with Marilyn Daly at Center 50 Plus, and she receives 150 food boxes from us each week. Gifts in Kinds program was our Good 360 program. This is truly the reason that we were able to start up our food box program, and we're able to get the basic need items into the evacuees' hands as quickly as possible. With this partnership with Amazon locally, as well as Bed Bath & Beyond and Walmart, we can get just about anything to anyone donated to us and back in those individuals' hands. We also have some investments that are available through DAF and Acorn funds. And when these two pandemics hit, we were able to get funds released immediately out of these funds and into people's hands. There's a minimum buy-in of $5,000 or a minimum buy-in of $1,000, and then the interest that accrues off of that, the person that owns that DAF fund can decide what nonprofit organization they want to partner with. I ran through it pretty quickly. Again, I profusely apologize for my tardiness. Does anyone have any questions for me about United Way and the work that we're doing right now?
Any questions? Stephanie?
Thank you, Mr. Chair. Thank you for being here. I know I recognize the issue with the wildfires and how it throws off our schedules and our whole life for that matter. But I want to, last night we had our board meeting, United Way board meeting, and I serve as the vice chair with Bud Pierce as the chair. And every time I see that fire video, having driven through fire myself, it just like, it's pretty emotional. And this morning on the way in, I got to the office pretty darn early this morning, about 7 a.m., and I drove by Safe Sleep on Front Street. And here was a young man with his mom sitting outside that looked about the age of my grandson. And I know United Way was on the rocks here a few years ago, but the things that United Way has been doing in the last 2 years for our community have been amazing, and a lot of other organizations as well. But I just want our employees to know that we reviewed our audit from 2019 last night, and the amount of percentage that is used for administration in United Way at the Mid-Willamette Valley is much lower than the average nonprofit, and that the money and the resources are getting to the people that really need them. Things like safe sleep, the showers. I know Ron Hayes and I spoke last week. What's some of the biggest needs? And they've actually, I don't think you mentioned this, Stephanie, I think we've purchased 2 or 3 RVs and donated them to people. And last night we talked about potentially buying those RVs and maybe not donating them, but keeping them in a fleet at United Way and just letting people stay in them with leases for free. So there's amazing things going on. So I want to encourage our employees this year to understand that the dollars that you give are being put to really good use in our community in a year that really needs it. So thank you for your presentation today.
You're welcome. You're welcome. What's raised here stays here, and it's how we operate every day.
But it's amazing. It's not even staying here. You heard wearing Glide yesterday. I mean, the United Way of the Mid Valley has expanded throughout the state, and they're really going where the need is, and it's not just here in the Tri-County area. So.
The need in Warm Springs was a shock. We weren't expecting that phone call, and they were hit really hard with COVID. And the fact that we were able to get them what they needed immediately made a huge difference in their ability to treat their individuals and get them someplace safe.
Well, I like to put Melissa on the spot always. Just can't just sit there. Would you talk about what the county efforts are going to be in the program, maybe what we've done in the past, what targets are, and any particular interesting events that I'll want to participate in?
So the employee contribution campaign for 2020 kicks off officially on Monday the 12th. We're going to run through the 30th this year. We always have the pledge forms so individuals can pledge a portion of their paycheck monthly, I believe, towards the United Way, and they can choose where their money goes. There is an option. We got a little bit of a late start this year on the campaign simply because of all of the wildfire recovery efforts, and so we just actually met last week with the department reps, and so we don't have any specific fundraisers scheduled yet. Obviously with COVID, we're having to work within social distancing guidelines and guidelines around food service. So departments are going to have to be a little bit creative this year to come up with fundraising ideas. So that will be more information to come. We do have a United Way intranet page, so employees can check that periodically to see what fundraisers are scheduled. In the past, we've done a lot of potluck related fundraisers, so like chili feeds and that kind of thing. So definitely will be interesting to see what departments come up with this year. Last year we raised over $13,000, so looking forward this year to trying to top that number. And I think there's a lot of interest when we met with department reps in making sure the dollars go towards the wildfire recovery efforts. So we'll see how that goes.
Great. Thank you.
I'm only concerned because the chili feed might be threatened.
Right.
I'll wear the mask. We'll work it out, okay?
It may be one of those years where we encourage people to just do a donation of what they were going to spend on those chili feeds, Sam. And I know how much chili you ate, so it's probably at least $500 from your pocket that needs to go straight to United Way.
Sorry to disappoint, Sam. Commissioner Montano.
All right. Thank you both. We appreciate it.
It was my pleasure.
Okay, that concludes our agenda. Mr. Cameron, do you want to read the calendar?
Sure. Mr. Chair, After our board session today, we're going to have media availability right now, after we read this thing and adjourn. So it says 10 o'clock. That's about when we'll be there. Later today at 11 a.m., we have a joint Marion Lynn County wildfire response in the Commissioner's boardroom here on the 5th floor. At 3 o'clock, there is a Fema briefing for local officials in the St. Am High School gym in Mill City. At 10 o'clock today, what do we got? We got media availability again. So we got that on there twice. So just so you know, we're going to be at media availability 2 times at 10 o'clock. And Thursday, the 8th, at Kaiser Marion County breakfast at Sherry's Restaurant, 7:30. Thursday, the 8th, fire update Commissioner's Boardroom at 8:30. Friday, the 9th, a fire update at 8:30, Commissioner's Boardroom. Friday at 10 a.m., Association of Oregon Counties District 6 meeting virtual. Tuesday, the 13th, Marion County Covered Bridge breakfast. And that is at, the Covered Bridge is on 510 North 3rd Street in Stayton at 7:30. Tuesday at 9 o'clock, calendar review in the Commissioner's Boardroom. And what do we have, Monday the 13th? Let me better check the schedule here. We got a few things here. So is it Monday the 13th or is it Tuesday the 13th? I'm reading from here. It's not me that's confused. Well, even though I'm easily confused.
Tuesday is the 13th.
Yeah, so I'm going to go back here to where's Association of Oregon Counties was Friday. It looks like there's nothing that we're together on Monday the 12th, according to my schedule.
Probably an update.
There's
Fire
a
update at 8:30.
Yeah, it's not on my schedule. So to avoid any confusion, on Monday the 12th, there's a potential that we may have a fire update at 8:30 in the morning. And then Tuesday the 13th, there is a management update at 9, looks like 9:30 or immediately following calendar review. And there's a Stayton County breakfast on Tuesday at 7:30. And then this last thing was, so calendar review at 9, management update at 9:30 on Tuesday the 13th.
I don't know if you listed it, so Monday would be AOC Zoom type meetings, and we would be together at a legislative meeting.
Yeah,
probably.
there is potential at the legislative committee, and that is at
I think
11:30, virtual legislative committee. I may not be there, Sam, because I've got some personal time that I got to get up to my house. But I'm going to try to do virtual, but there's still no Verizon service in Detroit.
Fine.
I think there's the back here. Did you do the back?
Is the back?
Yeah.
Oh, boy.
And
Oh, my
then
gosh.
Did you
Okay.
Aren't you glad it wasn't
No.
your turn this
Yeah,
week?
this has really worked out nicely.
We're Wednesday here at 9 a.m. on the 14th, back for board session. Wednesday at 9 a.m., a joint Marion Lynn County wildfire response in the Commissioner's Boardroom. And then Wednesday at 3 o'clock, a Fema briefing for local officials back in Mill City at St. Am High School.
Okay, thank you.
Thanks, Jane.
So that concludes our board session. We're adjourned. We're going to take a 5-minute break, and then we'll come back for our media availability.